everyone, and welcome to our Vistatec Life Sciences in Focus podcast, fascinating conversations with global life sciences experts. This is a space where we interview life sciences experts once a month. I'm your host, Maria Mateos. I guess you all know me by now, and I'm very excited to talk to our amazing guest for today, Julieta Pacheco. She has plenty of experience in clinical research. She's been with CTI, Resolution, PPD, now part of Thermo Fisher, and even on the sponsor side with J&J, and now she's with the medical affairs company, apart from doing other things. So Julieta, would you like to tell our listeners a little bit about you?
Yes, of course. Hi, everyone. Thank you so much for inviting me. Thank you, Maria. Can I call you Mary?
Yes, of course. And may I call you Juli?
Yeah,
as we normally do. Awesome.
Fantastic. We're friends.
That's
so
great.
Thank you so much, Mary, for inviting me. And well, I want to introduce myself. I'm Julieta Pacheco from Buenos Aires, Argentina. I study biochemistry in Universidad de Buenos Aires. Buenos Aires University is a public university in Latin America and Argentina. It's very famous around the world. And well, I developed my career I started in a hospital, working in a hospital, and then my career turned down to the clinical research. Suddenly, I started as a lab technician in a clinical research institution, and then step by step, I developed my career inside this field. So I'm really excited to all the things I learn and continue to learn in this field.
Thank you, Juli, and thank you for sharing. And I cannot express how happy I am to have a fellow Argentinian here on stage with us. Thank you for sharing your experience. And you have plenty. I mean, in clinical research, you've been all over on the sponsor side, on the CRO side. So could you share with our audience about your current role and how your experience with the medical affairs company is?
Yes, sure. So, well, I started as a lab technician in a clinical research institution and then turned to clinical trial assistant in a CRO. Then I was promoted to a CRA. And finally, a recruiter discovered me in LinkedIn because I optimized my profile. And the meantime, I was CRA, I founded Embracing Clinical Research, ECR Academy. So the way I express myself in the social media leads me to be discovered by a recruiter. And I started as a clinical trial liaison. This position is a bridge between the sponsor and the principal investigator. I found the key opinion leaders, the investigators, to share with them the currently studies, the protocol, the new protocols, new treatments, and choose them to work with us. And then with the knowledge that I had obtained in the sites, in the growth, in the CROs, and with the sponsor, I could get more tools to share solutions to the sites and develop strategies to improve the protocols.
That's fantastic. That's fantastic. And thank you so much for sharing that with our audience. And you have plenty of international experience based on what you've said about your career. So I'm wondering, how would you say that cultural nuances impact clinical trials?
That's a good question. I'm going to answer in two parts. First of all, by the professional side, because when you are working in a company, worldwide company, you have to face many situations, talk with many complaining people, complaining cultural, intercultural situations. So I recommend listening. And when you started a new position in this field, you have to create bonds with the experienced colleagues. So I recommend talk with them, ask about the culture difference, how express yourself with others, being polite and professional. And well, if you need help, do not hesitate to request support with an experienced colleague. That's my suggestion about that.
Yeah, that's a very good point. And I guess that doesn't just apply to clinical research. It's very, very broad, and I couldn't agree more. I'm curious to know about the patient side now.
Yes, and from the patient side, we need to recruit patients to be part of the clinical research protocol, the different studies that improve treatment. So, in Latin America, for example, not so many people know about the clinical research. We need to improve the dissemination of the clinical research. And I believe that this impact in the healthcare professionals too. Because, for example, I started this position by chance. So my goal here is share with others, share with the healthcare professional that they have another way to work, another way to impact in the patient. And I encourage the professionals to enter to www.clinicaltrial.gov to reach out all the clinical research protocols that currently are ongoing.
Yes, that's a very good point. And you may know by now where I'm coming from with the patient's question. And I see your position serves as a bridge between patients and the sponsor. And in this case, the work we do here at Vistatec with language localization also serves as a bridge between the protocol, the study, the pharmaceutical company, and the patient to make sure they can understand each other, and on top of everything, patient safety, that they feel safe, that they are spoken in a language they can understand. So that's really, really cool.
Well, I would like to add that I believe that these cultural nuances could create barriers between patients and the studied, because the social, educational, and economic difference in between each culture and population could reduce the recruitment in the clinical research. So we need to disseminate what we do and provide confidence to the participant, because we are following the good clinical practices, trying to do the best for them, and with safety for the patient and safety for the data.
Yes, I really couldn't agree more there. And I'm very happy that we are both collaborating to that from different perspectives and parts of the trial. Juli, let me shift here a little bit, because you wear many hats. It's not just the medical affairs company, right? You established ECR Academy to support professionals in clinical research a couple of years ago. So I wonder what inspired you to create this platform, and how does it address the gaps we have noticed in the industry?
Thank you for mentioning ECR Academy. I create ECR Academy, Embracing Clinical Research, to share with the healthcare professional the tools, the confidence to start a new career in the clinical research field. I know by my own background, by my own experience, that this kind of job in healthcare could be hard and could get some kind of overwhelm for us. So I would like to provide a new way to work, a new way to provide an impact to the patients. So in ECR Academy, I create programs that could give you tools, community, and knowledge about the clinical research field.
That's fantastic. And I guess that's something we very much missed back ages ago when we graduated and started our careers. So I'm sure the new generations will really appreciate this and benefit from it. So how do these programs equip professionals to excel in the clinical research field?
Well, in ECR Academy, we have 3 programs. One of them is mentorship to guide you in between the change, the change between the hospital, for example, the hospital to turn out to a big company. So you have to be prepared, you have to develop skills, social skills and hard skills. So
Yes, and sorry to interrupt you, but
no
it's a huge change from a hospital to a big corporation.
Exactly. When you are working in a hospital, maybe you have, I don't know, you are focused on only in the patient. But when you are working in a big company, in a worldwide company, you have to be focused not only in the patient. You have to add the administrative skills, the social skills, because we have big groups working together, and you have to add a good communication. For sure,
Yes,
it's the key. It's a key.
yes. And coming
Clear.
from a hospital or a healthcare institution into a corporation, it's like the best of both worlds because the patient remains in the center of everything.
Exactly. Yes, that's the same, I think. And the second program is an optimization of your profile. It's a personal brand. It's a program that we don't. In that program, I help the professionals to improve their resume, their LinkedIn profile, and being a strategy performing interviews.
Oh, good.
Fantastic to get your new role, I think.
Yeah.
Yes, that's important. And the last program I create this year is the clinical trial monitoring course that provide to the healthcare professional tools, knowledge, and support a community to start your career as a clinical trial assistant or monitoring clinical research associate. That's the position that all want. I believe all want, because these positions in the clinical trial field could improve your quality of life, not only your career.
Yeah, and let me pitch in real quick there. The clinical trial monitoring course, it's not just for healthcare professionals or people who want to get into the field, into the site, but I have seen translators taking that course to learn the clinical research jargon to translate better. I know our linguists do take this course. And I might be interested myself. Who knows? I've been thinking about it for a while. Juli, this has been amazing. Thank you so much for your time. I know we need to come to an end, but before we go, is there anything else that you'd like to share with our audience? Any recommendations?
Yes, I invite you to follow us in LinkedIn and in Instagram. I started to post to be an Instagrammer. It's just a dream. And well, I encourage to to follow your dreams, to develop your skills, to get the job that you want. So if you want to turn your career and comes to the clinical research field, you are here. Do you have here a place with support, with a community?
Oh, that's awesome. That's awesome. The feeling of community. I love it. Thank you so much, Juli, for your insight, and thank you to our audience for being there every month. This Life Sciences in Focus podcast is available on Spotify, Apple Podcasts, and other leading platforms, as well as YouTube, if you prefer to watch us. And please make sure to tune in again next month for more Vistatec Life Sciences in Focus, fascinating conversations with global life sciences experts. Thank you.
Thank you. Bye-bye.